awkward because we're going to be learning a lot tonight. We're going to learn about the clinical application of the endocannabinoid system. And I have two special guests tonight. You've met them before. We have on board Dr. Janice Knox and Dr. Rachel Knox. They are endocannabinoid specialists, and they've enlightened us on the history of cannabis. And we talked about a lot of things related to that history. And then last week we talked about the science of cannabis and the endocannabinoid system. And what I took away from that is that the endocannabinoid system is a very elaborate structural system that to some extent represents a foundation upon which all of our other support systems are interconnected or supported by. And there are many aspects of our lifestyle that positively affect the endocannabinoid system. And we're going to evaluate that concept more today, but we're also going to do it in the context of the clinical setting, in the context of clinical application. Many of you had questions about what about asthma, what about seizures, or what about this disease or that disease, and we're going to touch base on some of those things. But one thing that you'll learn is that it's more complex than just the use of one substance or more, and we're going to get into that in more detail tonight. So without further ado, I'm going to welcome my colleagues, and I like to say also friends, to the stage. Dr. Janice Knox, hello, how are you doing today?
Oh, I'm fantastic. Thanks for having me again, Dr. Montgomery.
And thanks for joining us. And Dr. Rachel Knox, hello, how are you today?
I'll mute and say hello.
Oh, wonderful. Glad to have you. So as I shared with the audience, we took this in succession, and we talked about the history of the history of cannabis, really, and how we dealt with a lot of politics and things. And one thing that I've learned from Dr. Janice Knox a couple of years ago when we talked about it, this was something that was very commonly used in medical practice. And so we went through the history of that. And the interesting thing is that a lot of it had to do with the hemp plant. And the hemp plant itself competes in many different industries, not just the medical industry. So I mean, clearly that's the impetus to get rid of the use of cannabis for the sake of these single molecule therapeutic treatments. But there are other paper and other types of industries that was competing. So that was an interesting historical perspective. And then last week we dealt with the science behind it, and how we talked about how much we know, but how much more we have to know, how much more we've yet to learn. And that ended up in a lot of interesting questions being raised about the application of the endocannabinoid system. We talked about measuring it in the central spinal fluid, and also there was some discussion about studies on potentially measuring it in the blood and the potential application of measuring derivatives of the endocannabinoid system. So that's very exciting. So we can measure things, we can kind of correlate it with clinical scenarios and the like. So why don't we just delve on in? I'll start with you, Dr. Rachel Knox. Since we talked to Dr. Janice Knox next week, we'll alternate, we'll come back. I want to start 30,000 feet up and talk about the clinical application. From one standpoint, there's a clinical application of cannabis. Lots of people want to know how to use that, how to use CBD oil, et cetera, et cetera. But I also want to think about the clinical application of the endocannabinoid system from the standpoint of understanding it and manipulating it in ways that other than just using CBD oil and cannabis, but also using other therapeutics, natural therapeutics that is, and manipulating the endocannabinoid system in a positive way. So kind of give us an intro to that and kind of help us delve into that, because later I'm going to kind of delve into different disease states, but give us a picture of how you approach this and how you think about the clinical application of it.
So, well, the 30,000-foot view of the clinical application, right, is a niche application. When you take what you just mentioned into context, which is all of the 50,000 and counting innovative uses of the plant. So really, when we think about the clinic and medicine, we are talking about a fraction of the use case for this plant. And when we think about the world of cannabinoid medicine, more lately, we stratify the knowledge into two camps: cannabinology and endocannabinoid. Right? Cannabinology is a focus on the plant science. It's pharmacology. I like to say that clinical cannabinologist might be your cannabis pharmacologist, right? A pharmacologist specializing in cannabis, or an herbalist who specializes in cannabis. They might be clinical, or herbalists by definition work with patients, but their principal knowledge base surrounds the plant. Same with pharmacologists. You might have clinical pharmacologists, but their primary sphere of understanding is around pharmacology, and they have some understanding of how to apply and manage, patients clinically. Now, on the flip side of that coin are the endocannabinoids, which I would liken more to our conventional, medical doctors, or even more like ancient healers, folks whose principal focus is on the body and how the body works. And for those of us who have to work with how the body works and understand how to modulate the body to restore health, then yeah, we kind of need to know something about all the tools at our disposal that work on that body. So when we combine clinical cannabinology with clinical endocannabinology, right, those folks who are studying the function and dysfunction of the endocannabinoid dome and how to modulate it as they move from bench to bedside, practice what we call collectively cannabinoid medicine, right? So cannabinoid medicine, hopefully, will be a new field of medicine with boards of specialization to come with it at some point. But really, cannabinoid medicine is the clinical application of cannabinology and endocannabinoid to address disease at its root cause. Sometimes we'll say functional cannabinoid medicine, just to drive the point home that cannabinoid medicine and clinical endocannabinoid, by definition, is functional, right? It requires that we understand physiology at a cellular level, so that we understand, how to manipulate this body, not just using cannabis and cannabinoids, but cannabimimetics at large. And we divide cannabimimetics into substances and practices, right? So, very simple examples of cannabimimetic substances are essential oils, right? Essential oils are full of terpenes. Terpenes exist in the cannabis plant and all sorts of botanicals, right? They're what give botanicals their aromas and their flavors. They're also highly, pharmacologically active, biologically active. They work on similar pathways, right? So they work on pathways in the endocannabinoid dome. They stimulate and modulate the way cannabinoids interact at cannabinoid receptors and other receptors. So we consider them cannabimimetic or cannabinoid mimicking. And a good example of cannabimimetic practice is osteopathic manipulation or massage. Right? There have been studies that have demonstrated that, after massage, the body naturally elevates its anandamide levels by 168%.
Wow.
So that's the practice that stimulates the release of anandamide, our bliss molecule, right? And so we can call that sort of practice a cannabimimetic practice. And when you understand this amazing physiology and how to modulate it, then you kind of, realize that, well, lots of things are cannabimimetic. It really breaks wide open the breadth of things that we can use to help, right, drive homeostasis via this system, whether that's cannabis, cannabimimetic substances at large, cannabimimetic practices at large, or even pharmaceutical drugs. I'm sure Memo mentioned last week that this system has explained to us how some pharmaceutical drugs work, when we didn't know how they worked, and FDA approved them anyways. Now, endocannabinoid pathways, because we're looking for them, explain why some of these very conventional Western therapies work.
Yeah, so you mentioned massage therapy increasing anandamide levels, I think 100-fold, et cetera. How is that measured?
Cerebral spinal fluid. Yeah.
Okay.
Yeah, you got it, Chris.
So basically, they've done it where they've done actual studies, massage therapy, and do a lumbar puncture before and after. and measure. That's fascinating. Last week we talked about potential blood measurements, and Dr. Janice Knox mentioned, I think it may have been Stanford or someone who's doing research. We don't know how close that is. What's the word on the street in terms of the potential availability of blood tests for anandamides, or do you know how close we are with that?
Well, I think that's the million-dollar question, right? How do we measure the endocannabinoid ohm? And remember, when they're going into the spinal fluid and just measuring the anandamide levels, or even a blood test, if they're just measuring the anandamide levels, that's still not an adequate picture of what a person's tone is. Because the tone is affected by, or at least it's described by, not only the levels of the endocannabinoids like anandamide or 2-AG, but also the quality and the quantity of those receptors as well. So we're still not able to measure the full picture of the endocannabinoid ohm. And I do believe that they're working on that. I haven't read any recent research on where they are, but I will say that the individual or individuals who are able to do that is to make a lot of money, because that is, a key understanding is, where is an individual's endocannabinoid tone? And they all vary. And I think I mentioned last week that it is as specific to an individual as their fingerprints are. So no two people have the same tone. They can have the same disease process and respond differently to the treatments, right? So there is no standard treatment. There is no one size fit all. And I think that's moving it back in the right direction. It would be amazing to be able to measure this. And I've always fantasized, Dr. Montgomery, is having that magical medicine cabinet where a person can just touch it with their finger, put a little saliva, whatever it is, or sweat, and able to measure their tone. It'll spit out your anandamide levels, where you are, what you need as far as dosing, right? Whether it's a cannabinoid or endocannabinoid or even conventional medicine. You may need a different dosage at 12 o'clock noon than you need it at 8 o'clock in the morning. And we need to be able to drive to that direction, being really specific and really precise about what the body needs. Because if you think about the way the endocannabinoids work in the body, they're made on demand and used locally, right? Even though the same receptors are all over the body, anandamide and 2-AG are produced all over, as well as other neurotransmitters, but they're used locally. They're not, when a joint expresses that endocannabinoid, they're not going all over the body and working. They're working in that specific area. So that is what we need to figure out how to harness. And we're not there yet.
Yeah, no, I hear you, and it makes sense. And just listening to you. And I remember you used the analogy of a fingerprint the last time we talked in terms of the variability of the endocannabinoid tone. What do we know, or do we know about the change in, say, a given individual or individual's endocannabinoid tone as they age? That's one. And then two, do we know, I think you alluded to this some last week, and just remind me, what do we know or understand about that variation in tone, certain disease states, some versus others? I think you remember some was high and some were low, and I want to visit that as a second question. But what do we know what happens with aging or as we get older?
Okay, so Dr. Ethan Russo defined clinical endocannabinoid system deficiencies. Now we've extended that to dysfunction, endocannabinoid system dysfunction. And these are the 5 things that affect the function of your endocannabinoid system. Number 1, genetics. We can't do a whole lot about that. Number 2, aging process. We can't do a whole lot about that either if we're fortunate. Number 3, the foods that we eat, pharmaceutical drugs, and stressors, whether they're environmental or you're inside your home or toxins or all of those things, or just life in general, how stress you. Those are the major factors that will influence the direction of that endocannabinoid tone. And you can overdo that tone and wear it out, right? If you overdo drugs, or you don't get enough sleep, or all these things can push that or you worry, you're so stressed out. you've pushing your system out of whack, right? And so those are the things that affect the endocannabinoid system, aging being one of them. Now, when you're talking about dysfunction, whether you're talking about deficiencies or excess, with deficiencies, you're talking about whether you have adequate levels of the endocannabinoids with the classical endocannabinoid system description, or the quality and quantity of those receptors. Are those receptors there? In excess, usually you have an overabundance of something, and usually it's the receptors. So for example, in cancers, we see an overabundance of certain receptors, whether it's a CB1 or CB2, and in some cases, like the vanilloid receptors. You'll see an overabundance. Now, it doesn't start the disease, it doesn't trigger the disease, it sort of gives us an idea of what's happening. And when you see that overabundance in cancer, it gives you sort of a kind of a prognosis of where that cancer is, right? It's reaching, it's trying to respond, so it's making all these receptors. In deficiency, you have a deficiency of these things, whether it's from drugs or whatever caused that deficiency, or involution of those receptors. The receptors are not there. For example, in endometriosis, they have a low level of CB1 receptors. They have low levels of the FAAH. They have low levels of I think, GPR55, another G protein couple receptor. They are deficient in those receptors, right? For whatever reason they are. So those measurements help us to decide which way those disease processes are and give us a clue to how we can start to treat them.
Gotcha. So we do have some insight in terms of receptors, receptor count. In some disease states, there may be increased receptors. But when I think in other systems, such as cardiovascular systems like heart failure, for instance, when we see an upregulation receptors, oftentimes that's related to a decrease in, say, the agonist of that receptor. And then vice versa, we see an increase in the agonist of the receptor, we see a downregulation receptors. Is that what we're seeing in the endocannabinoid system, or is it somewhat different? So like in cancer, you see an increased number of receptors in cancer. Is that, you think that's because there's a decrease in the endocannabinoid tone? In other words, the natural agonists are not being produced, and so the body's producing more receptors to try to maintain the tone, or do we know what that interplay is so far?
When we're talking about disease processes, we are talking about at the cellular and subcellular level, and oftentimes what I'm thinking is happening is that the physiology gets disrupted and the system cannot correct itself for whatever reason, right? Whether it's the stressors we're living under that has thrown you so off base, that the endocannabinoid system itself, that is the foundation of everything else, whether it's cardiovascular or respiratory, it's been thrown so off that it is responding in a certain way, right? And so the truth is, those receptors that you see that change in volume in your cardiac disease is just a signal that something has gone terribly wrong with that endocannabinoid system. Is it due to genetics, or is it due to your aging process? Is it due to the food that you're eating? What has thrown things off base? So this is the picture that you see, and this is how the body is trying to fix itself. Remember, the role of the endocannabinoid system is to repair and to protect, right? It is to maintain that balance, that homeostasis. When it's dysfunctional, research is showing us that we're tying more and more disease processes to that dysfunction. What caused the dysfunction? That's functional medicine. That's precision medicine, looking at those receptors, going in and see what is actually causing the process. And it's important when we're talking to patients to let them know that this is not something that happened to them overnight. And it's not something you're going to correct overnight. So we have to do a deep dive into their history, and maybe history in their childhood that precipitated this, right? That ultimately to this end result. A good example I love using is, a lady delivering a baby, right? If that baby doesn't go through the vaginal canal, that baby doesn't get the bacteria in its GI tract. So it has a normal GI function. And so we see a lot of patients with inflammatory bowel disease have some history of either they were C-section babies, or they had ear infections where they used a lot of antibiotics and wiped out those, wiped out the microbiome, the gut, which is very instrumental in creating, what's needed to make those endocannabinoids and other neuroreceptors. They don't have that bacteria. So it's something that can start early on and you get an end result. And I tell all my patients, this is a result of your body screaming at you that something's become dysfunctional. And we need to figure out how to fix it.
So what I'm saying is, what I'm hearing you say, part of it is just getting an understanding for the underlying cause. And so in terms of, the patient's lifestyle or their medical history from way back when they were born up to, what they ate and activity level and the like. Now, as I recall going through, we'll bring Dr. Rachel Knox in on this one, but a lot of our patients in the comments since the last show and even toward the end of the last show had certain clinical questions. I listed, some of the disorders. And what I want you to do is maybe give us an outline. I'm just going to call out a disease state and give us an outline of your approach to this patient. Now, granted, whether you're using cannabis or not, but we understand the endocannabinoid system, is affected by many different approaches. So, and these are some of the related to questions that some of our listeners had. And type 2 diabetes is something we see commonly. Somebody did ask a question about type 2 diabetes. And I imagine you see patients in your setting there. What is your approach to a type 2 diabetic as an endocannabinoid specialist? And I'll just ask it that way.
Dr. Janice already answered this question. So when in functional medicine, again, let me say this. You are a functional medicine doctor or nurse or chiropractor or whatever, you need to know endocrinology, right? Definition endocrinology is functional medicine. And so some of the themes that functional medicine doctors abide by, we do as well. Dr. Janice mentioned we take a holistic, total inventory of a person's history. Is vitally important. We're trying to figure out whether the root cause of a disease process is a physical one or a mental one or even a spiritual one, or maybe a combination of those things. What we're realizing more and more is that the endocannabinoid dome, we like to say, is the biopsychosocial spiritual model of medicine. Meaning if we're not asking about a person's mental history along with their spiritual history, we're not taking a complete physical examination. So we begin there. We begin with a complete history. This standard conventional intake, certainly, right? We want to know the presenting complaint. We want to do a review of systems. We're going to want to know about your family history, what prescription drugs you've taken, have ever taken, are taking, right? We're going to want to know your lifestyle habits. I mentioned those cannabimetics before. I like to stratify intake across physical and mental and spiritual activities and behaviors. So when we're thinking about, your mental health, I'm going to ask, what are the states of your relationships? We know toxic relationships contribute to a lot of daily stress that translates to chronic inflammation. So I want to know what kind of relationships you have with your family, with your friends, with your colleagues at work, maybe with authority at work. Maybe you are the authority. What is your relationship with those that you work with and that who you have to manage? Do you feel supported in your relationships, right? We go pretty deep here. In the spiritual realm, we might ask, do you have a spiritual practice? Do you believe in a higher power than yourself? Are you supported by your peers with respect to spiritual fitness? Those are the sorts of things that we're trying to get to the bottom to. So typically a first session with us is very long, very inquisitive, because we have to understand you before we begin to make even minor recommendations. If we are treating cannabis like conventional drugs, then we're treating cannabis like a Band-Aid as well. right? If we're not getting to the root of the underlying cause and we just treat you symptomatologically, right? Like treating your chronic pain with CBD and THC or a combination therein, but we're not addressing what's at the root of your chronic pain, right? You know, maybe it's as simple as your mattress sucks, right? And if we're not replacing that mattress, it doesn't matter how much cannabis or you know, other modalities we throw at you to help you feel better, because we're going to send you right back home to that mattress that is perpetuating your illness. So, you know, when it comes to a type 2 diabetic, cannabis isn't first line therapy. I mean, it's adjunctive, but typically first line therapy is correcting your diet, correcting that microbiome, talking about prebiotics, postbiotics, or excuse me, yeah, postbiotics, and probiotics. Yeah, and so when I construct any of my plans as well, we're going physical cannabimimetics, mental cannabimimetics, and spiritual cannabimimetics. In that physical realm was where my prescriptions might reside. But that's just one small component to the overall care plan for that particular patient. So, you know, from head to toe, we're talking about a lifestyle overhaul by and large, and using cannabis and cannabinoid therapies as a bridge while we work together, and principally while the patient works to reverse lifestyle habits, nutritional habits, mental habits, spiritual habits that begin to restore endocannabinoid dome function.